Assalamu alaikum to my lovely nurses. I hope you are fine and your family is good. So today I will talk about scope of practice. Scope of practice mean what's the delegation task the RN should have to do, and the LVN and the LPN and the UAP. RN is registered nurse, LPN is licensed practical nurse, LVN licensed vocational nurse, and the UAP unlicensed assistive personnel. First of all, we will talk about the RN, the registered nurse. The registered nurse can do the clinical assessments, and the clinical assessments mean the patient admitted in the ward. The first clinical assessment the RN should have to do. Initial client educations, discharge instructions, that the RN responsibility, clinical judgment, that is also RN responsibility, initiating blood transfusion, that is also a RN responsibility. Now what the LPN and LVN can do. LPN licensed practical nurse, and the LVN licensed vocational nurse. The LPN, the LVN can do monitor RN findings, and they can reinforce education, mean the RN already give education to the patient, but now the LPN, the LVN can reinforce education to the patient. And the routine procedures mean like Foley's catheterization, IV insertion, so that LVN and the LPN can do. Ostomy care, like colostomy care, she can do. Tube patency and enteral feeding mean like NG tube feeding, and the enteral feeding the LPN, the LVN can do. Specific assessments mean she can assess. Assessment mean the assessment of the CVP line, IV line. So this specific assessment she can do, the LVN, the LPN. Now what unlicensed assistive personnel, the UAP can do. The UAP can do the activities of daily living. Hygiene mean the patient bathing and the mouthwash and the face wash, everything the UAP can do. Linen change and the routine stable vital signs, only the stable vital signs the UAP can do. And the documenting input and output, and she can also change the position. And for example, the UAP can check the blood sugar, but if the blood sugar is high, she should have to inform the RN. So this is the delegation is very important topic. Mostly questions are coming in the exam. So I hope you like the lecture. If you like, please share, subscribe my YouTube channel, and don't forget to push the icon bell button so you can receive my coming videos notification. Thank you very much. Take care yourself and your family. Allah Hafiz.